alarming numbers out of New York regarding kids and coronavirus. City health officials issued an alert overnight that 15 children have been hospitalized with a mysterious illness possibly tied to COVID-19, saying they suffered from persistent fevers along with rash, abdominal pain, vomiting, and diarrhea. Doctors say it's a very rare but serious syndrome in some kids who get sick, severe inflammation affecting the heart and other organs that can send the body into a state of shock and cause organ failure.
This new shock syndrome is really a very small tip of a larger iceberg.
12-year-old Juliet Daly had severe stomach pain and was airlifted to the hospital. She was diagnosed with COVID-19, which doctors believe triggered cardiac arrest.
I felt like things were breaking apart really quickly and that everything was terrible.
Juliet is now expected to make a full recovery.
Take this pandemic seriously and make sure you continue to social distance. We almost lost her.
These new cases making headlines as parents and leaders grapple with questions about when children should go back to school. By and large, kids have been largely spared from coronavirus.
In fact, if you look at the history of what we've seen, children do very well.
But there have, of course, been deaths, including the 5-month-old daughter of a New York firefighter. Her daughter, Jose Prosper, calling his daughter, Natalie, a warrior princess for her fighting spirit. Now, a new study by the National Institutes of Health hopes for the first time to give us a clearer picture of how coronavirus is impacting kids here in the U.S.
We'd all like to know why children don't get as sick with the virus. Obviously, it's very fortunate that they don't. But it's fascinating that they don't, because it's quite unusual for respiratory viruses to spare young children like this.
Dr. Tina Hartert is leading the study, which will focus on 6,000 people from 2,000 American families. Every 2 weeks, kids and some of their relatives will get a nasal swab to see if they have COVID-19 and if it's being passed on to others.
Do they transmit infection as effectively as we see, certainly in adult populations? And that's definitely going to contribute to us having knowledge about whether we should reopen schools, summer camps, let children visit with their grandparents.
Doctors say most children with coronavirus are either asymptomatic or have very minor symptoms. Because of that, many don't get tested, so we really don't know the infection rate among kids. This new federal study hopes to try and answer that. The study should last about 6 months.